Hello, my name is Hilary Baldwin and I run the Acne Treatment Research Center in Brooklyn, New York. And I'm here at Maui Derm to talk about a poster that looks at the reduction of sebum utilizing the medication Clascoterone. Now you might think we always knew that Clascoterone reduced sebum, and we did, but we only knew that in vitro. So they went back and finally did an in vivo study taking a look at sebum reduction over a 52-week period of time in 40 patients with mild to moderate acne. The patients applied the Clascoterone twice a day, as is on the package insert, for those 52-week period of time. And this was an open label, single center study. The primary endpoint of the study was improvement in acne lesions, looking at the IGA success being clear or near clear, as well as looking at reduction of what's referred to as casual sebum, which is looking at the sebum which is left on the face 2 to 4 hours after cleansing of the skin with no application of any creamy substance in between. So these patients were evaluated at baseline and again several points along the way until that 52-week at the end of the study. They looked at IGA, they looked at inflammatory and non-inflammatory lesion count reduction, as well as reduction of sebum, but also some clinical findings of oiliness of the skin, as well as facial shine and even pore size. And what they found over the 52-week period of time with a steady decline in all of those parameters was a 79% reduction in oily skin, a 78% reduction in facial shine, a 49% reduction in pore size, 55% reduction in IGA, and lesion count reductions in the 70s and the 50s for inflammatory and non-inflammatory lesion count. So yes, indeed, this medication does decrease sebum production in humans in a clinical trial, and along with it, the parameters that you would expect, like the lesion count reduction, global assessment, as well as the clinical findings that you would expect from somebody whose sebum has been reduced, i.e. decrease in facial shine, oiliness of the skin, and pore size.